Can you briefly discuss how practices serving HIV patients can most effectively implement screening, brief intervention, and referral to treatment SBIRT procedures?
So approximately 50% of HIV-infected patients have histories of underlying substance use disorders. So substance use disorders are chronic relapsing conditions, so it's really quite important to, one, not only screen for them, but to provide evidence-based treatments for them. One of the modalities that has been recommended as an evidence-based intervention is something called SBIRT, which is also known as screening, brief intervention, and referral to treatment. So this would mean that, at least in HIV clinical care settings, the first and most important thing to do is to screen them, which means that you have to ask if someone has used some alcohol or other types of drugs. So once that has been identified, it's important to sort of recognize whether that underlying use of alcohol or drugs is in any way interfering with their health care, whether it's accessing health care, remaining in HIV care, problems with adhering to antiretroviral medications. But most of the evidence suggests that if you can refer those patients effectively to treatment, especially after an evidence-based brief intervention, that those individuals do better. Now, the brief interventions are typically based upon motivational interviewing or cognitive behavioral therapy, and they can be very brief, up to 2 to 3 minutes, can be done by an HIV clinical care provider or a social worker, or can be done on a computer-assisted guidance. And all of these are really quite effective at getting people into treatment, and if you can get them into treatment, then you can obviously reduce the negative consequences of drug use. Now, there are a number of resources that are available, because the screening modalities, the brief interventions, and the referral to treatments are somewhat different, but the AIDS education and training centers have a number of them on their website, which are very, very effective, and they can be used and adapted for HIV clinical care settings. Individuals can take those and adapt them to the medical records so that they can be done directly within the medical record and ultimately be done systematically. And I think that as we're looking at the Affordable Care Act sort of emerging with the use of electronic medical records, that this will certainly be the wave of the future.